Hi, everybody. Welcome to our Tuesday evening call. We get together regularly to give an overview and an introduction to LifeWave and the star of our show, our newest product, X39. Pretty soon we're going to say something else. That's a hint, everybody. So glad you're here. What we do this evening is we give a short summary and overview of the company and the technology, a little bit about our patch, the X39, and then we introduce our special guest this evening. We are thrilled to have Dr. Walt. He is substituting for Dr. Jeff, who had a fractured tooth, and he thought the patches were going to handle it, but he's recovering. So send him our best, and we're going to get on with the show, and I'm going to turn things over to, I forgot to share. After that, then we have invite you to come on with your questions and stories. So you can put those in the chat, and we will move forward by starting with Gregory, giving us a brief summary of the company. Over to you, honey.
All right. Thanks, Robin. Good evening, everyone, and welcome to our stem cell presentation. And I'm going to go ahead and share my screen, and we'll get this show on the road. So certainly we're going to talk about LifeWave X39 and how it activates stem cells. But before we do, just a realization I came to a while ago. I finally figured out what I want to be when I get older, younger. And I don't know if any of you can relate to that, but let me start out by asking you a couple of questions. If anything were possible, if you could wave a magic wand and anything were possible, what's one thing you would do that you would choose to experience differently in your health? What is one thing you would choose to experience differently in your health? What would make a difference in your life? And what difference would that make for you? And with that being said, we're going to talk about some ways that might happen. But before we do, I'd like to just a general disclaimer. Our products are not designed or intended to heal, treat, or diagnose any disease. They do, however, help our bodies get back into a more healthy, regenerative mode, and many times some pretty wonderful things begin to happen. So let's go ahead and start about talking about stem cells, and welcome to the stem cell revolution, because certainly everyone wants to look, feel, perform, and live younger, and stem cells are the key because they're a vital part of our immune system that repairs and regenerates all the damaged cells all throughout our body. Organs, glands, tissues, muscles, bones, it's all there and regenerated when it gets old or damaged via stem cells. Here's the problem though. The older we get, the fewer stem cells we have. And by age 60, a small percentage remains. And the fewer stem cells we have, the faster we age and the slower we heal. So we're going to talk about how to put the brakes on the aging process. And what about stem cell injections? Because certainly they can be expensive, painful, risky, controversial, and no guaranteed results. Well, we've got some really good news for you, because with LifeWave, you can look, feel, perform, and live younger with a historic breakthrough in stem cell activation technology that we've developed. It's a new wearable technology in patch form that's actually affordable, safe, non-invasive, and it's drug-free, and it's a patented form of phototherapy, and I'm going to go through that in just a couple of minutes. It uses specific frequencies of light to increase and improve our stem cell activity. And this is the brainchild of our visionary founder and CEO, David Schmidt. He's a brilliant scientist and researcher, but David is also a genius inventor with over 100 patents and patent pendings. And David's been on the leading edge of phototherapy research and science for over 20 years, and he's already conducted over 90 clinical studies proving the efficacy of LifeWave phototherapy products. And many more studies are currently in the works. Now, LifeWave itself as a company is a 17-year-old advanced technology company founded in 2004 based on an energy-enhancing technology that David developed for Navy SEALs to increase their strength, stamina, and performance without the need of drugs, stimulants, or caffeine. It turned out to be so effective, it's now used by world-class athletes all around the world in almost every sport. We have our corporate headquarters and laboratory manufacturing spread out between California, Utah, and Ireland, which actually enables us to have global distribution to 75 plus countries with 14 global distribution centers. Now, the word is getting out on LifeWave, and LifeWave patches are now used by pro and amateur athletes all around the world in almost every sport. The media is beginning to notice, and you might have even noticed in the recent Olympics, some of the athletes wearing these little LifeWave phototherapy patches. So how does this amazing technology work? Well, it's based on a type of light therapy called photobiomodulation. And LifeWave patches contain very specific combinations of organic materials and nanocrystals that when applied or near the body, they're activated by our body heat. And then they begin to re-emit very specific wavelengths of light, which stimulate targeted and beneficial biochemical responses in the body. This is known as photobiomodulation, and it is the basis for our LifeWave phototherapy patches. Now, it's been a well-recognized and proven scientific principle that specific frequencies of light can cause specific changes within our body. For example, when we go out in the sun, a specific frequency of light causes and triggers our body to make vitamin D. We don't get a vitamin D download from the sun. We get a frequency download and our body creates the vitamin D. And likewise, another frequency of sunlight causes our body to make melanin, the chemical that gives us a suntan. Well, I'm happy to tell you that LifeWave's patented technology is based on the same rock solid, well-proven and recognized scientific principle. Now, for the last 12 years, our focus has been in the field of anti-aging and regenerative science. And in January 2019, almost 3 years ago, we released to the global market the LifeWave X39 stem cell activation patch, which truly is a historic and affordable breakthrough in stem cell activation. Some are calling it the holy grail of anti-aging and restorative science because we're actually doing what the multi-billion-dollar companies and big pharma have not been able to do. And that is X39 activates a very specific copper peptide that signals our body to activate our own stem cells while also altering gene expression of thousands of genes towards a younger and more vibrant you. So X39 certainly is a game changer. It's a true breakthrough, and our founder and inventor, CEO David Schmidt, says it's my greatest achievement yet. So yes, we have patents. Yes, we have clinical studies. Yes, we have field results proving X39 is actually turning back our biological clock, helping people to look, feel, perform, and live younger. And for us baby boomers, this is very, very exciting news. So what I'd like to do right now is turn the screen back over to Robin, and she's going to introduce our very special guest and doctor tonight. So back to you, darling.
Thank you, sweetheart. That was wonderful. As always, it's so great to learn about this company. It's a very special company, and we're at a very special time. So for those of you that are brand new, you are in the right place. So you might want to have pen and paper handy. There's more information to come, and I get to introduce our special guest tonight. Normally, it would have been Dr. Jeff Hubbard, but he had a little incident, a fractured tooth, and wasn't able to make it tonight. So Dr. Walt pinch hit for us at the last minute, and I love our rotation of doctors. They're all such servant leaders, such a gift. And Dr. Walt, he's a special one. He's a very special, they all are. Actually, we're very blessed in our community. He comes to us from a conventional background, having studied pre-med and medical technology, then became a nurse. Then he took a change in direction in 1990 when he visited China, and a whole new world opened up to him, and a career change and a new direction. Same career, being in the health field, but a totally different focus. And now he's a licensed acupuncture physician, and he lives part-time in Colorado and part-time in New Mexico. And I know lots of people that have been visiting with him and having consults and having amazing results. So I want to welcome Dr. Walter Young.
Hello.
Oh, you're from the intergalactic.
I still haven't got that change because they don't have anything but that right now. Yeah.
Well, good for you. Good for you. Well, good evening, and thank you so much for joining us this evening on the very last minute. And what a treat. What a treat. So let's just jump in. You've been with Lifeway for how long now?
Oh, I think a year and a couple of months.
The second time.
Oh, the second time, yeah. Because the first time I was in Florida, I had a practice there, and I was using the energy enhancer. That was 2005. Yeah. And actually, at the end of the year, that was the big year that I had a big bump, and I left for a year. Yeah. Not because of Life Waves. I was getting good results.
So Dr. Walt was actually with Lifewave in the early days and took a little break and then came back over a year ago, and we're glad to have him. So, you were with Lifewave, you loved it then. What is it that inspired you to jump back in?
Well, because of the X39, I got a call from Dr. Shang-Han Lu. She's a medical doctor that I've known for about 15 years, and she told me that this company, Lifewave, and I said, I know Lifewave, and she was, why didn't you tell me? And I said, I don't know X39. And she just said that David had developed this patch to activate our stem cells, and that was it. I mean, I just said, okay, I'm gonna come right in, let's go, let's get started. So it was really because of the X39 and what stem cells do for us, for the repair that is possible with that technology. I'd like to say something, Robin.
Sure.
Most people, I think, know that the basis of Western medicine, and I don't poo-poo Western medicine, I use both, is the study of the body, but it's on cadavers, on dead tissue. Now, as physicians, we need to always have a mindset as a scientist, like David is, reaching out into the bounds, and you've got to keep yourself open. If you've taken the physics, you've taken the chemistries and all this other stuff, you really have to realize that as we progress, you need to progress also. And this is really, medicine is going in the way of light. We know now, what was his name? Albert Pops. We know now that we are made of this light energy. All the chemical reactions that happen in our body start with light. Think of all this light bouncing around in your body. It's just like a fiber optic. We get messages. We see the TV through fiber optics. We see, it's all light energy. So I want people to realize that we're now finally utilizing light, our own light we give it off in infrared, and it activates the crystals, and the crystals give back a message for the body to start getting the GHK copper peptide going. So this is a new paradigm jump, and physicians have to really look at it. Don't say, oh, I don't know anything about that. I don't care. I just give drugs. Drugs only handle certain things. We're handling a heck of a lot with just one little patch.
I love it. You said so many important things, but truly this is a new paradigm. And as a practitioner and anyone who's got a body, I think, is to continue to be open, to learn, to explore, because there's new discoveries every day. I listened to this amazing scientist last night, and I was blown away with what's available if you're willing to be open. So let's talk a little bit about stem cells, because a lot of people have heard about them. Some people know what they are. Most people don't really know what they are or couldn't explain them. So could you share why this is such a historic breakthrough to be able to activate stem cells with their own body heat?
Sure. The stem cells are, I like to call them mother cells, because that gives you an idea that they can become any tissue, any type of cell in our body where we need repairing or we need growth. They're like a miracle cell. And we know stem cells, and there's a lot of research going on with stem cells in Petri dishes and plates, and we see them becoming different things that we need to have in our body. So people like you and myself, our stem cells are a lot lower than somebody that's 28 or 30. So to be able to activate those stem cells without having to draw blood out on your own and then shoot it back in through this patch, it's It's a miracle. It really is. You know?
And so, like you inferred, the older we get, and Gregory mentioned
Yeah.
this, the faster we age, the slower we heal because we have less of those stem cells, but now we can have more.
Yep, we can have more. And I tell anybody out there, whether you're a user or a new person, one way to see it in front of your eyes is put an X39 close to some kind of a wound or injury. You'll see how fast it starts to heal. And I mean, I've actually felt it. I felt the tingling happen within minutes that I knew something was happening.
And the wound healing is dramatic.
Dramatic. Good way to see. Yep.
It's exciting. It's almost like you can watch it happening, like with a child who heals so fast because they have tons of stem cells. Okay, so this
yesterday I was a friend of mine just moved back to Taos. She just bought a real nice, cute little Adobe, and she has a dog, a pit bull. The dog's about 9 years old, and I was looking at her name is Sasha, the dog, and I said to Audrey, does she have hip problems? And she said, yeah, she's got some, hip problems. And I said, what are you doing with your patches after you're finished? And she said, I throw them away. And I went, oh, put them on Sasha. What's wrong with you? She went and got a fresh one and put it on Sasha. 15 minutes later, that dog was not having the problem she was having getting up in her bed. She said, my gosh, I forgot all about Sasha. And I said, shame on you. Even the animals can feel it.
The animals seem to respond even quicker. And that's a wonderful thing for everyone to know. A lot of people take half the adhesive off, wear it 12 hours, and then take the other half off and put it on an animal. And we have 5 animals. So, and they all wear patches.
Yeah. Good for you guys.
I know. It's wonderful. It's wonderful. So let's talk a little bit about how to get the best possible effectiveness from utilizing this amazing technology. How long should we wear it? Is there anything else we should do or take? Is there anyone who shouldn't be using it?
So I like to start off in telling my people to really be consistent. And that's across the board with, even if I give them an herbal formulation, consistency is really, it's really the true factor, really, because, and give it a good 3 months. You're going to have to drink water, up your water a little bit, because you need to be hydrated, especially in a higher altitude like here. I walk around with, my water constantly. People that shouldn't use it people that shouldn't use it are anybody that's had any kind of an organ transplant. We want to keep their immune system safe. We don't want to have any rejection going on with that. And, with the X39, the back of the neck, that's at cervical 7 or GV14 in Chinese medicine, or below 3 inches below your belly button. And that's called CV4. That's a dantian that we use. But in theory, if you're having pain, I've had people, I said, point to where the pain is. They say here, and I've actually just put a patch on it over their clothes. So remember, once these are within your zone, and some people have a bigger zone, like maybe 4 or 5 inches, and other people it's a little bit lower, but you're going to have activation of this patch with your infrared coming off. So remember that. And just you can put an X39 on your skin or over your clothes just to show somebody the activation, and it takes just a couple of minutes. Now remember, if you're looking for some kind of a relief, let's say we'll go back to the shoulder, and you're not getting it, there's a good possibility that those stem cells, because they've been taught to go to where it's needed the most first. It's going to handle life, affirming things first before it goes to the pain in your shoulder. And I've seen that happen too.
So they're really smart, those stem cells.
Brilliant. They've been created to really, they're our repair system, It's really important to realize that they're our repair system. And, we live in a post-industrial society. So you and I don't care how well you eat, we are bombarded with chemicals that we don't need in our body. And sometimes they need to activate and go after those too.
Okay, well, you said a few things I want to highlight because you talked about putting the patch on clothes. So it doesn't even need to touch the body, does it?
No, and that's what I do when somebody comes in, and I pull out the patch and give them a real quick synopsis of what I'm going to do. And then I continue talking with them. And I say, maybe 5 minutes later, I say, how do you feel? And they're like, what is that? You didn't even put it on my skin. And then I explain, the infrared coming off. And most people today understand this infrared because there's tests that we do. You can see the heat markers on your body. You can see the orange, you can see the red, the yellow, the greens, the blues, where there's no heat. So this is all factual. It's all test. You just have to keep up with science.
Beautiful.
Yeah.
I want to mention the science for a minute because Gregory touched on it, but you as a practitioner, and we do have thousands of practitioners, and they love our products because it enhances a clinical outcome, but they also love them because of the science. Would you just share, have you read much of the science that's available?
You mean of the patches? Yes,
Yeah.
definitely. And it's all with, the infrared. It's the energy that we're utilizing. Like Gregory said, the energy from the sun, okay? Imagine that hitting our bodies. We get a whole bunch of reactions. One that I think most people can understand is when a baby is born with yellow jaundice, we put them under what's called a Billy light, and it's a blue light. And that blue frequency binds together and gets rid of that yellow jaundice, and the baby pees it out. So it's the same principle. We're finding out that light is so vital to the human body. No chemical reaction goes on without it first having some kind of a biophoto modulation. It's a language inside of our body and outside of our body. How can I stick a needle in a point and it reacts and does something to the body inside? I'm giving off this energy that's going in, and it's reacting to that energy. I say something really, here's a simple thing. If I say CAT, everybody gets an image in their head. Now, if those were needles, it would be telling the body a certain image. Now, let me change one of those letters. Let me say, I'll change the C to a B. BAT is another message. So it's the same way with the crystals that are in each one of these patches. They will give a different message based on the infrared.
I love it. It's wonderful that people like you want to understand how it works, and then some people like us like to just know it works.
Just patch.
We don't need which is exciting. We have something for everyone. So could you help people understand, you mentioned it a little bit earlier, how long does it take for someone to notice a benefit?
Okay, everybody is different, even with my medicine, with acupuncture. So once again, I say be consistent, have patience. There's things going on in your body that you may not even know. For instance, you eat food every day. Do you know and do you feel that things are going on? Probably not, but things are going on. What you'll tell is if you start eating the wrong food or food that has no nutrition in it, you start to feel a little bit different. It's the same thing with the patch. Give it some time, be consistent, hydrate yourself, and go about your day just knowing that it's working.
Beautiful.
I haven't seen anybody not work.
That's pretty wonderful.
Yeah.
It may take some time though.
Yeah, I had a lady who she is very, very sick. I'm not going to get into it, but she said, and when she brought her supplements in, she was taking 27 different things. Okay.
A lot.
She's down to like 3 that I said, okay, you can do these. But she said to me when she was wearing the X39, that's when finally everything shifted in her body. Wow. And that was a big deal. And then she went off of it, because she thought, okay, it's done. And then she learned pretty quick, but it was about 2 months. And I saw her again here in Taos, and she reordered again because she said that was a miraculous feeling. I was able to get up. I was able to move. I had vitality. I wasn't cranky. So it wasn't really only that she had pain, she had other issues. The vitality was a big one. Her mentation was even better. She could think.
There's so many wonderful cognitive benefits. And we do recommend everyone get a health tracker and start out with a baseline before you start. And how do you recommend that for people, Dr. Walt?
If they once they get their life wave, there is a tracker in there. And I tell them to put down how they're feeling right now, check all those boxes. And as you go along, fill that out, because there may be things that you don't even are paying, you're not paying attention to. For instance, one lady said that, when she went to the hairdresser, her hairdresser said, your hair is thicker and it's growing. And she hadn't really recognized that, but she started to say, you're right, I am getting a thicker, my hair looks shinier. And that's at a cellular level. That's a good way of judging that it is working.
Wonderful. Well, let's open things up for our guests tonight.
Sure.
If you have a question, please put it in the chat. And if you, let's see, we have one in Q&A. I'll start with the Q&A and then I'll go to the chat. And please remember, symptoms only to stay compliant. We really appreciate that. And if you have a story, let us know about that too. Let's see, in the Q&A, Jennifer Starr says, I have a customer who's been using these patches for the past 2 to 3 weeks. She liked how she felt for the first 2 weeks, and the 3rd week has been challenging. I told her about retracing. She describes her symptoms as neurological tingling, numbness, and weakness in her legs. She has an autoimmune situation that affects her nervous system. What should I say to her?
I would have her wear the energy enhancer on the bottom of her feet to open up her meridians. Get some energy flowing. Sometimes that could be, yes, a retracing. But as far as the numbness and the tingling, that sounds like a circulation issue, and she needs some of that to be opened up. So I would use the energy enhancer.
Okay.
But have her be consistent with the X39.
Yes, X39 is foundational, and then add the energy enhancer, because we need energy moving through our bodies for everything to work.
Everything, yes.
And the older we get, that changes too. Okay. Yep. Chris said, I have a friend that fell and damaged a group of muscles and tendons that hold the shoulder joint in place and allow you to move your arm and shoulder. She's going to have surgery soon. How can I help her now and after her surgery?
Have her wear the X39 pre-surgery and post-surgery right away. She's going to have a wound there. So that's something that she doesn't have to have it right on that area, but very close to it, like over in the back of by the scapula, which is your shoulder blade. Anywhere in that area, I would have her use that, and also the glutathione, your antioxidant that you really need to keep healthy. I would start with those two. Don't bombard her too much.
Thank you so much for saying that. It's so beautiful to just keep it simple.
Yep.
The X39 is so comprehensive. For most people, we have them just where I wore it 90 days before I even looked at any other patches.
Yeah.
And so give when you have more stem cells, everything else works better too.
Yeah. Okay. And that consistency of 3 months, I know some people say, well, I did try the Baba patch for 3 weeks and I wasn't seeing anything, so I stopped and I went to the next patch. No. X39, and stay with it for 3 months very consistently.
We've heard that word a few times, consistency.
Oh, yep.
As that's a clue. And I remember one of our distributors, she said, compliance is really easy with this. It's just peel and stick. It's very different than other things. I mean, sometimes the hardest part is to remember to put it on and take it off. So sometimes people put an alarm on their phone and remind them. And some people put it by their toothpaste and toothbrush. So whatever works for you, but consistency is key. Yes, that's really good. That's really good. Okay, so we got a bunch more. Let's see. What patches would you recommend for a person who has, without naming the diagnosis, the area of the large intestine that pushes through the intestinal wall so they can feel the bulge in their lower belly? They can see this bulge. Right.
So once again, the X39, but you're going to have to be really careful with that, because I understand what you're talking about. Sometimes, remember, we need other therapies. And if that is a real big bulging through, that person may need some kind of surgery. But once again, with the surgery, if they have to go that way, you've got some patches that are going to help them really, really heal. I think if you're looking to heal that bulge, the X39 is going to work, but you're probably going to need a bigger intervention.
It works really well with other things.
Yes,
I
it
mean,
really.
I had a surgical procedure, and the surgeon was amazed. And we hear this all the time at the speed of healing.
Yes.
It's quite extraordinary. Okay, this is an interesting one from Elizabeth. She says, how much do good supplements or food augment X39's effectiveness?
Well, I don't know. There's no research that we know about that, but I'll tell you one thing about supplements. More is not better. You need to have a practitioner that can guide you as to what you actually take. I'm going to give you a little hint. If I take one herb, and I usually show this to my patients that come, their first consultation, one herb, let's take valerian root, and everybody's heard of valerian root. That one herb has what's called a nutritional profile. And if you saw everything that was in that one herb, you would understand what I'm going to say now. If you're eating healthy, and let's say you're taking some kind of an herbal formulation, you do not need to bombard yourself with a lot of pills. We were created to be eating the right food. They have all the minerals, the enzymes that we really need. As long as you're getting your 8 or 9 essential amino acids, that's your building blocks, the X39 is going to work better.
That's really important for everyone to understand. And David Schmidt, our founder, talks about this all the time. We need to do our part.
Yep. We really do.
We've got to eat good food. We got to rest. We have to hydrate. We have to relax, de-stress. We have to do our part. The patches do amazing things, but we have to do our part too.
Yeah.
So thank you for that.
Sure.
And sometimes people do take too many supplements.
Oh, I see it all the time.
Yeah, I might be one of them. We'll talk later about that.
All right.
Okay. Okay. I have learned that I have a left hip that is almost bone on bone. It makes it difficult to walk. What would you recommend?
Well, you're going to put the X39 on. I would like you to do the energy enhancer and to increase any kind of circulation to that area. Because remember, when you have an increase in circulation, you have more red blood cells going there. And who's attached to red blood cells is oxygen. So you're starting to heal better. If you're constricted because you have pain, and you're going to constrict with pain, or you have constriction because of stress, anger, anxiety, whatever it is, you need to open that up. So that's why I do like the energy enhancer. I also like Eon, but we're going to talk about energy enhancer and X39.
All right. This is Dr. Walt's show. You get to pick, and we always get to talk about energy enhancer. And and that is a 2-patch system.
Yes. Sorry. Yes.
Yeah, most of them are 1 patch. So someone asks, is there a way to, this is Chris, is there a way to accelerate the retracing if you're willing to go through the discomfort?
So if you start to have retracing, what I tell my patients, first of all, I talk to them about retracing.
Yeah, would you explain it? Because some people might not know what it is.
Right. So it's kind of like going backwards, because you may have an injury and the X39 are going to start to pull out anything that is fibrotic or kind of quote unquote not working well. And as that gets dumped into your system, you start to feel a little punky. You may get headachy. You may have the blahs. So I tell them if you really want to break through it, keep the patch on and start drinking a lot of water. Yeah.
Great. And if it becomes too uncomfortable, you just
take it off. Take it off for a couple of hours. Right.
And to know that the retracing where, those old dead cells are being sloughed off, creating some additional inflammation, it may last a few hours, a few days, a few weeks, but on the other side of that, you're better than ever.
You're better than ever.
That's the cool part.
Yes.
Okay. Elizabeth says she is an elderly patient that says the X39 caused a sore that took a while to heal. Any thoughts about that?
I don't know where the sore was, if it was from the patch, the adhesive, but unless it was a sore that the body was getting rid of something, it could have been, but I have not seen that as of yet. Those are possibilities, because sometimes when we do retrace, it may be something that was in the body and it's pushing it out in that area. I don't know what was in that area before, but I would put an X39 really close to that. It's going to heal it.
Great, great. And, some people are sensitive with their skin. There's, I think, 1 in 10,000. This is a very special adhesive, and 1 in 10,000 people have a reaction to it. So you can just put it on your clothes.
Right. Put it on the outside of your clothes.
Yeah, great.
Yeah, we have a 5-year-old that had a reaction, not a bad reaction, but now grandma puts it on the outside of his clothes.
And it works great.
Yep.
Okay. My friend is not getting the results or noticing the results with the YH trio for her arm. What would you say?
The YH trio?
Yeah. Carnosine, glutathione, and EN. Mm-hmm.
Right. So I would start with the X39, to be honest. I would let those stem cells activate. And of the trio, I would then use the glutathione first. And I'm really serious about 2 to 3 months of that only, and start to see what starts to happen.
Okay, great. And there's a few people mentioning disease states, so I'm going to skip over those, you guys. So next time, symptoms only. Please explain the need for extra hydration with the use of X39 and all the other patches.
All of our cells are bathed in a saline solution. And if you're not drinking enough, we're telling you to go up a little bit, because we want the X39, the cells, to be able to be bathed with this fluid so they can move freely, go where they have to go, follow the light, the message. If you're sluggish, you're not getting enough, water going through, you're not getting the messages that you should get internally. It's like the difference between fluid water and maybe Jello. It's liquid, but it's sluggish. So you're not going to be traveling through the Jello as fast as you're going to travel through the water, that type of thing.
Okay. Well, we've come to the end of our time already. It goes so fast. Any other final comments, Dr. Walt, about anything? Because you see so much on a daily basis of what happens with these amazing patches and technology. Any final comments? Well,
here it comes again, is just really be consistent with the X39. Get your fluid up if you can, and just watch and be patient and do the 2 to 3 months of it. I've been doing it now, and I see things happening month to month. Really, I've started to notice my skin is different. Some people have said some certain things to me, and I'm 69. I'll be 70 in February. So, I'm glad that I found the X39. I'm glad that Dr. Lou called me, and I just can't wait to see what's going to be happening for not only me, but all of you guys out there.
Beautiful, beautiful. Well, thank you. And I want to put your phone number in the chat for everyone. What number, in case people want to sign up and have a personal consult, what number should I put?
575-770-9953. And if you text me, I will call you back if I'm with a patient. I'm really good about calling people back.
Wonderful. I know people have had amazing results working with you, and you do such a thorough job, and you care so much. What a gift. So thank you so much, Dr. Walt, for being with us. It's always a joy and a treat to be with you. And thank you everybody else for joining us. And if you're brand new, welcome. And I hope you enjoyed this evening. Please get back to the person who invited you and know that we have a guarantee behind our products, and we have a wonderful customer program. And if you're the kind of person that likes to share, we have a wonderful member distributor program that has a very generous compensation. So thank you everyone for being with us, and we'll see you next week. Bye-bye.